My name is Fifi Peters and I will be your moderator for this year's summit. And we therefore begin this year's program with an open dialogue with South Africa's Health Minister, Dr. Zweli Mkhize. He will be joining us to discuss South Africa's healthcare needs post-COVID-19 and whether national health insurance is still the answer. Minister, welcome and thank you for your time in what I see has been quite a busy day for you.
Well, thank you very much, Fifi. I must apologize. I'm detecting connection problems, so it might be cutting on and off because I've been missing some of the things you're saying. But thank you very much. I think it's a very timely summit to discuss the issues of health for two reasons. Firstly, from the point of view of the fact that we've just gone past the surge on COVID-19, and therefore we need to reinstate a lot of our health services back. But also we need to move and look into the future of a health service that is resilient, that is able to sustain shocks and crises that might come in the future. COVID-19 did put a huge strain on our health services. It showed us exactly where things are weak. Not that we didn't know, but going forward, we need to actually attend to those areas so that whenever there's another emergency that arises, it finds us in a better position.
Mm-hmm. And I'd like to speak to you about the position of the prospects of another emergency, Minister, because you rightly say that we did go past the first wave of the worst of COVID-19. But what we are witnessing elsewhere is the emergence of a second wave. And I'm just wondering about South Africa's readiness to have to confront such a prospect should the end of the summer season that is potentially helping us come to an end. What is the state of readiness of our healthcare system then, Minister, to handle a second wave of COVID-19?
Well, I can just say that one thing we learned with COVID last time is that until it hits you, you can never be sure of how to respond. But we had made enough preparations to be able to stay a few steps ahead of the pandemic, and we were able to get over the surge without having lost beds that we didn't overfill our ICU beds or run short of oxygen or ventilators. That was for us a good sign. Of course, the surge didn't go as high as what was anticipated in the forecast. But that the possibility of another surge exists is a reality, and we will be much better prepared than before. But it does depend on a number of issues. Firstly, it depends, of course, on us being able to maintain whatever improvement that had been achieved and be ready and agile to be able to respond whenever there are issues which are causing pressure on us. Like if there's a need for an intervention, it should not take inordinate time to be able to get to deal with it and correct those situations. At the same time, it also depends on how our people behave. If we behave in such a way that the surge comes up faster at a higher level than before, then we're obviously going to be overwhelmed, and that's really the issue that we have to keep an eye on. So at this point, I would say, with the experience we've had, we can handle another surge. But what has worried us is when we looked at other countries, a number of countries who have had a surge which is bigger and more intense than the previous one. And therefore, we must always be aware that whatever we went through may not be as much as what we're going to face. It remains open, an open question for us, so that we must always be alert and monitor the situation carefully.
Minister, is the possibility of a second or another hard lockdown also a prospect that perhaps your ministry is preparing for? We have again seen it happening elsewhere in the world, but of course elsewhere in the world their economies were not on a ventilator prior to the start of COVID-19. So the prospects of a second lockdown and whether South Africa's economy can handle such a scenario.
Well, we are not in a surge yet. The second wave has not reached us. We are monitoring cluster outbreaks that are coming out in a number of areas, particularly in the Eastern Cape, but they do not qualify to say that's a surge, although we've seen that these are is resurgence in areas which had already had a much lower reduction of numbers. But we are not actually immediately envisaging a lockdown level 5, 4, whatever. But we are basically focusing on containment measures, and we're encouraging people to do so. And in the process, we hope that we don't have to get to that level. We believe that it's important to keep balancing a good, the lives of people and the livelihoods, so that people can continue to do the work that they are doing. But looking into the future, we wouldn't suddenly wake up and have a lockdown. There will be an adequate amount of warning as we monitor the trends, and we'll be able to indicate long before if there's ever a need for any actions of that nature. So at the moment, what we're really insisting on is that our people must continue to observe distancing. They must continue to use masks, hand washing and sanitizers. They must take it as seriously as they did when there was a surge. Then there will be no huge surge after that.
But of course, Minister, we have received good news this week on the vaccine front. The likes of Pfizer and BioNTech are saying that their vaccine candidates have proven to be over 90% effective so far. And that announcement coming on the back of the announcement from Aspen just last week that it had partnered with Johnson & Johnson also to manufacture its vaccine candidate right here in South Africa, Port Elizabeth to be specific, once it was all systems go for that. So I need to ask South Africa's view on the progress that is being made on the vaccine front. Have we, like other countries, put in any orders, and if so, how much?
Well, I think, as you have indicated, it is exciting news to see that there is some indication of success in the trials that are showing 90% of success, and that, I think, is announced by Pfizer. But at the same time, you have seen the discussion last week by Johnson & Johnson that they also feel that things would have progressed to quite an extent. The earliest indication we had was that the first registration is likely to happen by the end of the year with the American Regulatory Authority, and hopefully that because we've got trials going on here, we could then follow soon after that. There are a number of offers that they are on the table. Excuse me. The offers indicate that we need to subscribe to one or other, but there's also a global facility which is called COVAX, which is about pulling everyone, and through solidarity, we get about 9 of the vaccines to be working together. So we would have a sense of which one is successful first, so that we don't put all our money in a vaccine that may not be successful. So where we are right now, we are negotiating with a COVAX facility so that we don't get left out of that situation. We're also having engagements to encourage Aspen, if their vaccine is successful, that the manufacturing and production should happen in South Africa. At the same time, we're also looking at the Pfizer. If there's any success on that, we also don't want to be left out of that. We think that South Africa has got biotechnological capability to be able to produce vaccine of the highest level. We're also looking at initiatives to ensure that whatever success we might be finding as South Africans, it must be shared with the rest of the continent, because, as you know, on the issue of the vaccine, we always say no one is safe until everyone is safe. In other words, vaccines must be available even to those who might be having economic strains. So all of this is work that we're busy with, and we're really being very hopeful. But the whole world is at the same level, and we're hopefully going to be part of those who will be there to get the first orders and also be amongst the first to manufacture.
Minister, just one last question on the vaccine front, because of course we are also conducting our own trial here in South Africa. It's been done at Wits University. It's the AstraZeneca one that has been done in conjunction with Oxford University there. And I just would like to know if there have been any latest ground-breaking developments that we should be aware of.
Yes, indeed, there is also the AstraZeneca trial. And as you will notice, we are linked to the global research community So whatever is happening here is happening somewhere else. So whenever there's going to be any announcement, it will be heard at the same time by everyone because we are all part of the same community. So at this point, we're still waiting to hear any new news, if one may say so, but there's no new groundbreaking announcement that has been made. But it's a very exciting era in science because you will notice that there's an explosion of research, of development, vaccine development, discoveries that have kind of come on before. But all of that is happening at a fast speed in a way that things have not been done in the past, in such a way that even the whole question of the efficacy of vaccines, the safety and so on, generally takes years to develop, but all of these steps have been collapsed and created a very interesting scenario together with new technology that has been brought onto the scene. So all of that basically means that whatever we hear, we'll hear at the same time with the rest of the world.
That is good to know. But Minister, as you rightly acknowledged at the top of the program, a lot of South Africa's pressures to our healthcare system predate COVID-19, and many of them will still be with us even once the virus has been combated. And I'd like to then ask what the government's plans are then to strengthen the healthcare system. What's the latest regarding strategic investments that you are looking to make to ensure an improvement in healthcare for the people?
Well, the issues that are fundamental in terms of us transforming our health system will not change much. Firstly, we need to know that we need a system that's going to ensure equitable access to healthcare, quality healthcare by all, irrespective of their capacity to pay, irrespective of their class and status in society, and whether they've got medical aids or not. Now, this universal health coverage is a global aspiration now. Every country is supposed to move in that direction, and the longer South Africa dithers and takes long to get to that point, the more that will actually be delaying justice in terms of health service delivery. Similarly, therefore, the issues that are fundamental to it is the fact that unless we move in that direction, you are going to find that our system is always found wanting when there are emergencies, as I've indicated before. There's a lot of focus now on what we call resilience and sustainability of our health systems. So the major issues to deal with are ensuring that there's adequate human resources, well-trained, well-motivated, good numbers of staff, all various categories that are necessary to render the best health services. Secondly, the best infrastructure that is able to make sure that we can deliver quality of care under whatever the circumstances. Thirdly, is the whole system issue of improved quality of care, where as you walk into the wards, the cleanliness, the issues of linen, etc., simple basic issues are taken care of. And fourthly, the questions that relate to improvement in the management culture, where things happen quickly, efficiently, and therefore there's no unnecessary undue delays in the whole process, where there's no problem of financial management, the issues of corruption out of the way, efficiencies, with adequate delegations getting to the lower levels so that people can do what they need to do. There are reports of instances where a hospital manager has to report to district office to get windows fixed and all of that. Now, all of that needs to be sorted out, and we're in the process of dealing with all of that. Linked to that, of course, is the improvement of the information system and technology. So all of these are things that we're working on, and we believe it's important to correct all of those. Then everyone will be able to understand which direction we're taking.
And Minister, are you able to give us timelines and targets that you have set for yourselves to achieve some of those things that you are working on?
In relation to the move towards establishment of national health insurance, we have tied a lot of these issues into that. Now, I think a lot of delays have happened with the COVID situation, and so we have to reactivate a lot of our plans to be able to make sure that as we get towards the end of this term, we have improved infrastructure, but we have already adopted a revised human resource development strategy, and therefore we're now going to each and every institution to say they must start working in terms of this new strategy. So we need to then be talking to a lot of departments to keep those posts that were filled during the COVID-19. They must continue to work on them. And so it's a matter now of having to go and negotiate for more resources to be able to keep the plans, particularly human resources. We're engaging on the issue of infrastructure, and some of that already is budgeted. This year, this particular year, we're close to 20 billion budgeted for infrastructure. But we had said we wanted to look at a whole new program of refinancing health infrastructure. We're negotiating all of that at this point. So once all of that is tied up, we'll have to make the necessary announcements.
Minister, just one last question on universal health coverage, or NHI as we call it in South Africa. Just regarding if it has in any way been impacted by COVID-19, as in if the envisioned rollout by government of NHI right now has been impacted by COVID-19. And I ask this against the backdrop of we saw the strong partnership that can happen between the public and the private sector when dealing with a crisis. We saw it with the level of collaboration in tackling COVID-19. And I'm just wondering then, the latest pronouncements of NHI, how it has been impacted by COVID-19, and perhaps the level of collaboration that will be seen in its rollout going forward.
Actually, there's a saying that there's always every dark cloud has a silver lining. Whilst we have been, frustrated and harassed and put under pressure by COVID-19, it did remind us that, by the way, we depend on each other. We are one system, and therefore we have to work together. And so one of the good benefits out of that is the extent to which we've been able to forge a lot of cooperation between public and private. Now, private and public sector have not been working very well together. But if you went to the laboratories, you operate like one laboratory, even though there were so many of them, mainly because now policy-wise we are approaching issues the same way, and therefore it has been easy. And we stand up and issue a report. We know for sure that it's covering everybody. That's the level of coordination that has happened. We have had an agreement with the private sector about the use of hospital beds when the public sector is under pressure. That is a very, very important development, because we were able to achieve that within a very short space of time. So whenever in future we move, we need to understand that, in fact, it is possible to work together. We have to keep improving on that particular situation. We started the engagements with the general practitioners, the idea being that as we move into the future, many of the private practitioners should be able to actually serve the NHI. And so we hope to develop from that kind of system. So all in all, I should say that there has been a good development in terms of sending a message that we actually belong together. And so we just need to make sure we refine that as we move into the future, so that at the end, we are able to say we've got a kind of system that is able to service our people without any gaps, based on the fact that others are private, others are public.
Minister, it would also be remiss of me not to ask or put to you what skeptics are saying right now regarding NHI, given the budgetary constraints that we are under, even more as a result of COVID-19, but whether we can afford it at this stage, Minister, and where that money will come from.
I think it's fair. If people are skeptical, everyone should be concerned about the fact that our economic situation is not so good. We've gone through a very strenuous COVID pandemic. We've had to actually release money to go and support health systems development. We've also had to put money to go and support small businesses and private sector in general, the unemployed and all of that. That has put a lot of strain into our fiscus. And so as we have retabled the recovery plan, it's all about trying to build everything, weave it all back together to say, to the extent to which we are able to raise revenue, to build infrastructure for hospitals, for schools, for all infrastructure that we need, is going to be helpful in helping to in ensuring that our economy is stimulated. So all of these things have to kind of work together. Moving into the future, we had done some calculations, and therefore it was work in progress, which was looking at what would be done between now and the 2024 to put the fundamentals of the national health insurance. I must say that on that side, we are continuing, because largely what we need for this particular time is to be able to put up our fundamentals of our systems, and that we are in the process of doing. We are also in the process of working on the issues around infrastructure and human resources. So that's going to be work in progress. So yes, the country has got a financial and economic strain, but nevertheless, the mistake we don't make is to actually equate challenges with the fiscus as we sit now, and what price is being paid by an unequal health system, which does not protect its citizens equally. So when I say that it's a global movement, a global aspiration, we met in a number of areas. On the WHO Afro region, every country has been urged to move towards universal health coverage, which in our case is NHI. When we're part of the G20 meetings, everybody, all the countries were urged to move in that particular direction. We've had several meetings now where ministers of finance and ministers of health have been paired together to make an undertaking in these forums that they'll continue to work together to prioritize financing health services, so that our first investment into building a vibrant economy is ensuring that we've got a healthier population. And we believe that we should be able to move in that direction, whatever the strains we might face. But this is something that must be non-negotiable.
Minister, I think a lot of people would agree with you there regarding that last point you made. But just one last question in closing, sir. And it's about your view and government's thinking of using technology a lot more to improve access to healthcare, to also improve patient outcomes, and retain a lot of healthcare professionals that are leaving the sector as a result of being overloaded, as a result of being burnt out, and as a result of a heavy stress. So what is happening in the private sector to strengthen the role that technology can play in alleviating some of the burdens in South Africa's health system?
You're quite right, absolutely right on 2 points here. Firstly, technology and innovation is very, very important in health services. One, to bridge the gap between, distance of underserviced areas and availability of technical and professional expertise. There's lots of work that can be done to be able to, offer the services to people who may not be in the immediate vicinity of a doctor. So those kinds of innovation, we need to work on those. There's also technology that is able to assist to improve the capacity of someone who might not have had high training, but due to technology, it improves the output, whereby, let's say someone is out in the village and all they've got is a simple gadget of a cell phone. They can actually take a lot of detailed information being prompted by a system to be able to get information, and a doctor who's hundreds of kilometers away can make a decision and actually guide the improvement of that particular patient long before that patient has to reach the hospital. They would have actually had a proper record in place. So there's telemedicine, there's a whole lot of issues, but everywhere you go, technology becomes the base on which you build your system, on base on which you build your patient record system. We've gone quite far now on technology, registering a lot of our people into the patient's health registration system. We are working quite far on the issues of technological interventions that are needed for treatment and for various interventions. And we have to be at par with the whole world. So I believe that it's a very, very important area there. We need to be able to have space to, allow young people to innovate, to create, to be creative, so that you can get new solutions. The other aspects that you have raised relate to the mental health issues of fatigue, the strain, the stress, and so on. It tends to be associated with overloaded, health workers, tends to be associated with people who are under pressure because they're using old systems, and yet there are things that can move things quicker. So, for example, people are working in a simple registry. If they've got to walk around for 20 minutes looking for one person's card, bend down there, go up there, look for the card, it tends to be very strenuous. Whereas if you've got an electronic system, within a few minutes, you've got the card back, and therefore the level of motivation remains high. So your point is quite correct. It actually is the way we need to go. And we need to be flexible enough to be open to new suggestions and new solutions.
And just a brief question, sir, on skills development, and not necessarily clinical skills, but rather non-clinical skills, because the Future of Health Index actually highlights this as a key area of concerns amongst a lot of young professionals in the healthcare space, not receiving or not feeling adequately prepared and trained in the areas of business administration and management of hospitals. I'd like to understand the thinking around improving non-clinical skills development in South Africa's public healthcare system, sir.
Well, you've again guessed right here, because the issue is that if you want the system to be well managed, you need to train managers, competence and effective management. Now, in this case, we are actually looking for a capacity building program through our National School of Governance, where we recruit younger managers or younger professionals, put them through the training so that they are able to understand the complexities of management. Most of the professionals understand the clinical side of issues, and yet you need them to have additional skills if they've got to manage at a higher level. And to do that, you need to make sure that there's purposeful, well-structured courses which should be able to help them, give them the basic core competencies that are needed to run in an environment in which they are. And then, of course, link that up in an articulated way with further development at the level of postgraduate training, so that they are able to grow as we move on in management. And that way we'll be able to invest in the future of our health services, because you'll have, well-trained younger who are going to grow into the system, innovate, and as they rise in the system, they rise with both experience and competence, and that balance is what we need to be able to look at. So there are plans to be able to assist in that direction.
Minister, thank you so much for your time and joining the virtual summit this year. We will leave it there. That was Dr. Zweli Mkhize, of course, who is South Africa's Minister of Health.